Headaches are one of the most common health complaints worldwide, affecting people of all ages and backgrounds. But what exactly causes a headache? In this video, we'll explore the different types of headaches, their underlying causes, and most importantly, how you can find relief. Whether you experience occasional tension headaches or frequent migraines, understanding the root of your pain is the first step toward effective management. Let's start by looking at what a headache actually is and why it happens. A headache is defined as pain or discomfort in the head, scalp, or neck. It can range from a dull ache to a sharp, throbbing sensation. Headaches can be occasional or chronic, mild or severe. The pain is often a signal from your body that something isn't quite right, but the specific triggers can vary widely. By understanding the basics of what a headache is, we can better appreciate the different types and their causes. Headaches are generally classified into two main categories, primary and secondary. Primary headaches are not caused by another medical condition. They include tension headaches, migraines, and cluster headaches. Secondary headaches, on the other hand, are a symptom of another health issue, such as sinus infections, dehydration, or even more serious conditions. Knowing the difference helps in identifying the right treatment and prevention strategies. Tension headaches are the most common type of headache. They often feel like a constant, dull pain or pressure around the forehead or the back of the head and neck. Stress, anxiety, poor posture, and muscle strain are typical triggers. These headaches can last from 30 minutes to several hours and are usually not accompanied by other symptoms like nausea or visual disturbances. Migraines are intense, throbbing headaches that can last for hours or even days. They often come with additional symptoms such as nausea, vomiting, and sensitivity to light or sound. Migraines can be triggered by hormonal changes, certain foods, stress, or environmental factors. Some people experience warning signs, known as aura, before the headache begins. Migraines can significantly impact daily life, making effective management crucial. Cluster headaches are less common but extremely painful. They occur in cyclical patterns or clusters, often at the same time each day for weeks or months. The pain is usually focused around one eye and can be accompanied by redness, tearing, or nasal congestion. The exact cause is unknown, but they are believed to be related to the body's biological clock. Cluster headaches are more common in men and can be very disruptive. Sinus headaches are caused by inflammation or infection in the sinuses, the air-filled spaces behind your forehead, cheeks, and eyes. The pain is often felt in the face, forehead, or around the eyes and can worsen with sudden head movement. Sinus headaches are usually accompanied by other symptoms like nasal congestion, fever, and facial swelling. Treating the underlying sinus issue is key to relieving this type of headache. Dehydration is a surprisingly common cause of headaches. When your body lacks enough fluids, your brain can temporarily contract or shrink, pulling away from the skull and causing pain. Dehydration headaches often feel like a dull ache and may be accompanied by dry mouth, dizziness, or fatigue. Drinking enough water throughout the day is a simple and effective way to prevent these headaches. Ironically, taking headache medication too frequently can actually cause more headaches. Known as medication overuse or rebound headaches, this condition occurs when pain relievers are used more than a couple of times a week. The body becomes dependent on the medication, and when it wears off, the headache returns. Managing medication use and consulting a doctor for alternatives is important if you suspect this is the cause. Hormonal changes, especially in women, can trigger headaches. Fluctuations in estrogen levels during menstruation, pregnancy, or menopause are common culprits. Birth control pills and hormone replacement therapy can also play a role. These headaches often follow a predictable pattern and may be managed by tracking cycles and discussing options with a healthcare provider. Caffeine can both cause and relieve headaches. For some, a cup of coffee can ease headache pain, while for others, too much caffeine or sudden withdrawal can trigger headaches. It's important to monitor your caffeine intake and notice how your body responds. Gradually reducing caffeine, rather than quitting abruptly, can help prevent withdrawal headaches. Stress is a major trigger for headaches, particularly tension headaches. When you're stressed, your muscles tense up, especially around your neck and shoulders, which can lead to head pain. Chronic stress can also contribute to migraines. Learning to manage stress through relaxation techniques, exercise, or talking to someone can make a big difference in reducing headache frequency. Both too little and too much sleep can trigger headaches. Irregular sleep patterns disrupt your body's natural rhythms, making you more susceptible to pain. Establishing a consistent sleep schedule and ensuring you get enough rest each night can help prevent headaches. If you suffer from sleep disorders like sleep apnea, addressing those issues may also reduce headache frequency. Certain foods and eating habits can trigger headaches in some people. Common culprits include processed meats, aged cheeses, chocolate, and foods containing MSG. Skipping meals or fasting can also lead to headaches due to drops in blood sugar. Keeping a food diary can help you identify and avoid your personal triggers, making dietary adjustments a key part of headache management. Environmental factors like bright lights, loud noises, strong smells, or changes in weather can all trigger headaches, especially migraines. For some, even minor changes in barometric pressure can bring on pain. Identifying your environmental triggers and minimizing exposure when possible can help reduce the frequency and severity of headaches. While regular exercise is generally beneficial, intense physical activity can sometimes trigger headaches, especially if you're dehydrated or overexert yourself. These are known as exertional headaches. Warming up properly, staying hydrated, and listening to your body can help prevent exercise-related headaches. Spending long hours staring at screens or reading without breaks can cause eye strain, leading to headaches. This is especially common with poor lighting or incorrect screen settings. Taking regular breaks, adjusting your workspace, and using proper lighting can help reduce eye strain and prevent headaches. Most headaches are not serious, but some can be a sign of a more serious condition. If you experience sudden, severe headaches, headaches with fever, confusion, weakness, or vision changes, seek medical attention immediately. Persistent headaches that don't respond to treatment also warrant a visit to your healthcare provider for further evaluation. Diagnosing the cause of a headache often involves a detailed medical history and physical exam. Your doctor may ask about the frequency, duration, and characteristics of your headaches, as well as any associated symptoms. In some cases, imaging tests like MRI or CT scans may be needed to rule out underlying conditions. Accurate diagnosis is key to effective treatment. Making simple lifestyle changes can go a long way in preventing and managing headaches. Regular exercise, a balanced diet, adequate hydration, and consistent sleep are all important. Stress management techniques like meditation, yoga, or deep breathing can also help. Small adjustments in your daily routine can make a big difference in reducing headache frequency. Staying hydrated is one of the simplest ways to prevent headaches. Aim to drink water consistently throughout the day, not just when you feel thirsty. Carry a water bottle with you, and try to limit sugary or caffeinated beverages, which can contribute to dehydration. If you're active or in a hot environment, increase your fluid intake accordingly. Managing stress is crucial for headache prevention. Techniques like deep breathing, progressive muscle relaxation, mindfulness meditation, and yoga can all help lower stress levels. Even simple activities like taking a walk, listening to music, or spending time with loved ones can provide relief. Find what works best for you and make it a regular part of your routine. Good sleep hygiene can help prevent headaches. Try to go to bed and wake up at the same time each day, even on weekends. Create a relaxing bedtime routine, avoid screens before bed, and keep your bedroom cool and dark. If you have trouble sleeping, talk to your doctor about possible solutions. Adjusting your diet can help prevent headaches. Eat regular balanced meals and avoid known trigger foods. Keeping a food diary can help you identify patterns and make informed choices. Don't skip meals, and try to include a variety of fruits, vegetables, whole grains, and lean proteins in your diet. Engaging in regular physical activity can help reduce the frequency and severity of headaches. Exercise releases endorphins, which are natural painkillers. Aim for at least 30 minutes of moderate activity most days of the week. Choose activities you enjoy, such as walking, swimming, or cycling, to make it easier to stick with your routine. Poor posture, especially when sitting at a desk or using electronic devices, can contribute to tension headaches. Make sure your workstation is ergonomically set up, with your screen at eye level and your chair supporting your back. Take breaks to stretch and move around throughout the day to reduce muscle tension. Excessive screen time can lead to eye strain and headaches. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for at least 20 seconds. Adjust your screen brightness and position to reduce glare, and consider using blue light filters if you spend long hours on digital devices. For occasional headaches, over-the-counter medications like acetaminophen, ibuprofen, or aspirin can provide relief. Always follow the recommended dosage and avoid using these medications too frequently to prevent rebound headaches. If you find yourself needing painkillers regularly, consult your doctor for further evaluation. For chronic or severe headaches, your doctor may prescribe medications such as triptans, beta blockers, or antidepressants. These treatments are tailored to your specific type of headache and medical history. It's important to take prescription medications exactly as directed and report any side effects to your healthcare provider. Some people find relief from headaches through alternative therapies such as acupuncture, massage, or chiropractic care. While the evidence is mixed, these approaches may help reduce muscle tension and promote relaxation. Always consult with a qualified practitioner and discuss any new therapies with your doctor. Biofeedback is a technique that teaches you to control certain body functions, such as muscle tension and heart rate, to reduce headache pain. Combined with relaxation exercises, biofeedback can be an effective tool for managing chronic headaches. Ask your healthcare provider about biofeedback options in your area. Applying a cold or warm compress to your forehead or the back of your neck can help relieve headache pain. Cold packs can numb the area and reduce inflammation, while warm compresses can relax tense muscles. Experiment to see which works best for you and use as needed for comfort. Aromatherapy uses essential oils like peppermint or lavender to promote relaxation and relieve headache pain. You can inhale the scent, use a diffuser, or apply diluted oils to your temples. While not a cure, aromatherapy may help reduce stress and provide comfort during a headache. Staying physically active is important for overall health and can help prevent headaches. Regular movement improves blood flow, reduces stress, and keeps your body functioning optimally. Even light activities like walking or stretching can make a difference, especially if you have a sedentary lifestyle. Keeping a headache diary can help you identify patterns and triggers. Record when your headaches occur, their intensity, duration, and any possible triggers or symptoms. This information can be invaluable for your doctor in diagnosing and treating your headaches more effectively. Once you've identified your headache triggers, do your best to avoid them. This might mean making changes to your diet, managing stress, adjusting your environment, or modifying your daily routine. Even small changes can have a big impact on reducing headache frequency and severity. Dealing with chronic headaches can be isolating, but you're not alone. Support groups, both online and in person, can provide valuable advice, encouragement, and understanding. Sharing your experiences with others who face similar challenges can make coping easier and help you discover new strategies for relief. Headaches aren't just an adult problem, children can experience them too. Common causes include stress, dehydration, poor sleep, and vision problems. If your child has frequent or severe headaches, consult a pediatrician to rule out underlying issues and discuss appropriate treatment options. As we age, the frequency and type of headaches can change. Some people experience fewer headaches, while others may develop new patterns. Age-related health conditions, medications, and lifestyle changes can all play a role. Regular checkups and open communication with your doctor are important for managing headaches as you get older. Hormonal changes don't just affect women, men can experience hormone-related headaches too, especially with changes in testosterone levels. Both men and women should be aware of how hormonal shifts can impact headache patterns and discuss any concerns with their healthcare provider. Migraines are more than just bad headaches. They're a neurological condition with complex causes. Genetics, environmental factors, and brain chemistry all play a role. Migraines can be disabling, but with the right treatment plan, many people find significant relief. Understanding your specific migraine triggers and working closely with your doctor is essential for effective management. For those with frequent or severe headaches, preventive medications may be recommended. These are taken daily to reduce the frequency and severity of headaches. Options include certain blood pressure medications, antidepressants, and anti-seizure drugs. Your doctor will help determine the best preventive strategy for your needs. For some people with chronic migraines, treatments like Botox injections or nerve blocks can provide relief. These procedures are usually performed by specialists and may be considered when other treatments haven't worked. Discuss the risks and benefits with your healthcare provider to see if these options are right for you. Genetics can play a significant role in your likelihood of developing headaches, especially migraines. If you have a family history of headaches, you may be more prone to experiencing them yourself. While you can't change your genes, understanding your risk can help you take proactive steps to manage and prevent headaches. Headaches are a complex and common health issue, but understanding their causes and triggers is the first step toward relief. From lifestyle changes to medical treatments, there are many strategies you can use to prevent and manage headaches. Remember, if your headaches are severe, persistent, or accompanied by other symptoms, always consult a healthcare professional. By staying informed and proactive, you can take control of your headache, health, and improve your quality of life.